This
Okay.
conference will now be recorded.
Okay. Welcome to our second Tarrant County Unity Council Communication Committee. Thank you all for coming here this morning. I know it's early and it's Monday, so thank you for starting your week off with us here. Okay. Okay. So for today's meeting, we'll have a brief recap of what happened last week or in our last meeting last month. And just as a reminder for anyone that's new in here today, I'm Tanisha Stanford. I'm a health equity specialist here with Tarrant County Public Health, and I'm the head of the Communication and Education Committee here, and I also help out with transportation. And so, again, this morning we'll take us through a quick refresher from the last Communication Committee meeting, and then we'll talk a little bit about policy. We'll look back into some plan recommendation examples. Um, we'll look into our equity indicators, and then we'll have our discussion in preparation for our next meeting. And then, of course, we'll close up things and address any questions or comments. Okay. Does anyone have any questions before I jump into things? Okay, that's okay. So, in our last meeting, we went over some data regarding some of the communication inequities that exist within Tarrant County. We learned that there are 125 languages spoken throughout the county and that 16.3% of Tarrant County are foreign born. Further, we acknowledge that over 200,000 residents in Tarrant County have limited English proficiency, which we know affects their ability to understand important information and navigate the environments around them. Outside of language barriers to communication, we acknowledge that some other inequities to communication could also exist in age and disability status. In the era of technology compiled with navigating COVID 19, so much of our information is disseminated through digital platforms. So we have to consider the 11.6% of Tarrant County that are elders who may not be as technologically savvy, as well as the 10% of Tarrant County that possesses some form of disability that could potentially affect their ability to communicate and receive important health information, which all brought us to literacy and health literacy rates throughout Tarrant County. We learned that literacy is simply the ability to read, write, and speak and listen in a way that allows us to communicate effectively and navigate the environments around us. And that health literacy is the degree to which an individual has the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. We explored literacy rates in Tarrant County and found that for Fort Worth ISD specifically, less than 50% of students between third and eighth grade are meeting the literacy standards of the STAR test as of 2019. Further, we learned that 1 in 5 adults in Tarrant County cannot read well enough to succeed at a fourth grade level. At that point, we explored some plan recommendation example, which we will revisit a little later in this presentation. And then we took into consideration ways to communicate. Just one moment. Give me just one moment. Let me fix my screen for you guys. Can everybody see my screen now? Yes?
Yes.
Okay. Thank you. I apologize about that. Okay. Again, we will explore some plan recommendations later on in this presentation. And then we'll take into consideration, oh, and from our last meeting, we took into consideration ways to communicate and build trust within our communities and organizations through a brief review of the words matter, how language used in healthcare settings can impact the quality of pediatric care, hosted by the Center of Healthcare Strategy. And finally, we discussed some impacts that we'd like to make through this committee. Another thing that we will explore a little later in the presentation as we discuss our communication equity indicators. Okay. In order for us to best enforce change in our communities and organizations, we have to ensure that our policies align with our goals. So, what is good policy? According to Pepperdine School of Public Policy, good public policy seeks to define issues and implement strategies that will produce a measurable and positive result for the general public. Effective public policy will support democratic institutions and processes, serve justice, encourage empathetic and active citizenship, and solve problems efficiently and effectively without causing a political rift. Thus, a successful policy is both the execution of a good policy and good politics. So, a major part of what we plan to do is to utilize a policy review framework that will be shared with everyone once we have finalized our process to review the effects of our organizations and communities to ensure that the policies we enforce are more equitable. Here on your screen, I provided some example policy framework excerpts that we have researched as a team, just so you all can have an idea of what to expect as we look at our policy review frameworks. And so our policy review framework is being worked on currently by Dr. Wingate. So if anybody has any questions or concerns about the policy review framework that we'll be implementing, please feel free to reach out to Dr. Wingate directly, okay? And also, as a reminder for any organizations that are interested, we as health equity specialists are available to assist in your internal policy review. So please do not hesitate to inquire about how we might be able to help you all through this process. I've also provided a couple of excerpts from the Tarrant County Public Health Media and Marketing Policy and the Fourth Ward ISD Division of Equity and Excellence Racial and Ethnic Equity Policy. On the left-hand side, we can see the excerpts from Tarrant County Public Health Media and Marketing Policy. The first excerpt states that Tarrant County Public Health will follow the national culturally and linguistically appropriate services standards that suggest that information will be provided in an easy to understand print and multimedia materials and signage in languages commonly used by the population in the service area. The second excerpt states that a goal of Tarrant County Public Health is to communicate, educate, exchange information, and interact in support of its mission using both traditional media as well as digital media that includes a host of social media technologies and web applications. Though both of these excerpts demonstrate the intention to disseminate information according to the common languages and cultures in the county through multiple platforms, just looking at it through an equity lens, we can see what we would want to see is how it intends to specifically tend to those pockets of communities that are hard to reach. Um, and then on the right hand side, we see the excerpt from Fort Worth ISD Division of Equity and Excellence, Racial and Ethnic Equity Policy that Ms. Barbara Griffith mentioned to us in our last meeting. And in this excerpt, we can see some of the ways that they intend to ensure an equitable learning environment for students. And just quickly, I'll highlight the third point, and it says, in order to ensure equitable practices regardless of race or ethnicity, the district shall actively monitor and work to eliminate the loss of institutional time due to disciplinary referrals. The district shall analyze and present annually the data regarding the number of students who lose instructional time due to disciplinary referrals. And I think that's a very interesting thing because as we talk about literacy rates and educational policies, we have to include those disciplinary policies that might pull students away from the classroom and thus create those educational gaps. Okay. So I would like for everyone to kind of just take a second to look at these, and I want to open up the floor a little bit and see how could these policy excerpts be made more equitable? Like, what do you guys think? Take your time, no pressure. No comments? That's okay. That's definitely okay. We'll keep on pushing in. So, as I mentioned in our previous communication committee meeting, we do not have to completely reinvent the wheel as we seek equitable solutions in Tarrant County. There are other cities and counties that have already put similar plans in place over the last couple of years, and thus we will look to some of these plans for inspiration as we continue to create our own plan.
Hey,
In
Tanisha.
our yes,
Sorry to interrupt you. This
no, it's
is
okay.
Lauren. I see Charles had a comment. I know that
Uh
you're
oh.
you're busy, so you can't always see the chat, but he said he's not sure if his mic's working though. Give it a go, Charles. Let's see what happens. No, we can't hear
Uh oh.
you.
That's okay. Let's read what he put in the chat. Did he put anything in the chat?
How about now?
Yes.
All right. Well, I was thank you. I was just looking at the wording in there, and I was just thinking if we're going to be completely equitable with this, then I think that and I like what Fort Worth ISD put in here, but I think that it should be expanded to other immutable identifiers beyond just race or ethnicity, because I think we tend to get kind of pigeonholed with the labels, and when we're talking race, the dominant racial categories seem to come up, and then unfortunately, a lot of the other ones, the historically marginalized groups, tend to get pushed into the background, and my feelings are that they should be included in here as well.
Yes, Charles. I 120% agree. I feel like as I presented the data in the last committee meeting, I feel like that's why I went into age and disability as forms of communication barriers or things that could prevent, people receiving equitable communication just because we do get so caught up on language and race,
Yes.
So I definitely agree with you.
So that was my contribution.
Thank you, Charles. Thank you. Before we move on, did anybody else have any contributions? That's okay. We'll keep it rolling. Okay. So, as I mentioned in our previous communication committees, we don't have to reinvent the wheel here. There are other counties and cities that have already put these kinds of plans in place. And so we definitely want to look to them for inspiration as we create our own plan. Um, I previously mentioned the King County Equity Plan and Social Justice Strategic Plan, where they plan to address communication and education inequities with a four-goal plan. I also previously mentioned the City of Arlington's Unity Council report, where they presented a short term goal recommendation of creating a community outreach networking empowerment communication tool, which they in short call Connect. However, There are some other plans that we will definitely be referring to throughout our process, and these might also include the City of Charleston Special Commission on Equity, Inclusion, and Racial Coalition, the Dallas Equity Indicator Report, as well as the City of Fort Worth's final report of the Task Force on Race and Culture, to name a few. And as we continue through our process, our plan recommendations may change or grow. So if anybody knows of any other plans that might be helpful to the work that we're doing here, please feel free to share it with us. And in the follow up email for this meeting, I'll be sure to include links to all of these plans that I've mentioned here. And that way you all can review them a little bit more in depth in your own time at your own convenience. Okay. Before we get into what our specific equity indicators are, I'd like to provide a definition of what an equity indicator actually is. According to the Institute for State and Local Governance, an equity indicator is a comprehensive tool developed by the CUNY Institute for State and Local Governance that helps cities understand and measure equality and equity in their city. It works across multiple areas and measures the disparities faced by disadvantaged groups on a regular basis, tracking change over time. And so we want to utilize our equity indicators to support us as we review and develop our policies to affect change within our communities and organizations. So, based on our previous discussion in our first communication committee meeting, we have come up with the following communication equity indicators. They would be information dissemination, literacy and health literacy, and then mis and disinformation in the era of COVID 19. So, information dissemination will address the ways in which we distribute information through our organizations and to our communities, as well as just to the general public. Literacy and health literacy will address components of our health and education systems, community and government resources, educational attainment, and more. Misinformation in the era of COVID 19 will address the mass amount of public information, false narratives, and mistrust that occurred as we received so much information during the pandemic, as well as the best ways we can ensure the clearest message for the next public health emergency. I know these indicators are kind of broad and they generally cover the communication and equities in Tarrant County, but I did want to know what everyone else thinks and if there are any other indicators that you all feel needs to be added as we pursue change and solutions. And then also, I just want to remind you all that this plan is for us all. So I want you all to think about your organizations and the communities you serve and see, do you feel that these indicators are sufficient to address the communication inequities that you all have experienced and witnessed? And now I'm opening up the floor for any comments.
Tanisha, would you mind repeating the indicators that you had developed?
Absolutely, Kylie, no problem. So the indicators are information dissemination, literacy and health literacy, and mis and disinformation in the era of COVID 19.
I will add, I just had my housing committee meeting last Wednesday, and one of the housing committee members had recommended adding language barriers in homeownership and financial education as a problem for housing accessibility. I don't know where exactly that fits in, if it just fits under like general literacy levels, but financial literacy and specifically like the home buying experience was included in my last meeting.
To that point, this is Donna. To that point, Kylie, um, one of the things I was thinking about is access, and where does access fall in these indicators?
Okay. And I'm so glad that you all brought this up. And that's why we're doing this as a team, because on my initial list of indicators, accessibility and language barriers were a part of the list. And I was wondering, not wondering, but I was unsure if they both fit under maybe information dissemination. But I'm glad that you all mentioned that because, like I said, I did have that on my original list, and I will for sure go ahead and add accessibility and language barriers back into the mix for us. That's no problem at all. Anybody else have any indicators that they'd like to add on? That's a okay. That's a okay. 5 indicators is a lot, and we'll be able to do a lot with those. So we'll move on to our discussion portion. So, as we solidify our indicators, we definitely want to know the best ways to measure those indicators. So, I want to open up the floor to you all to see what are some ways that you feel like we can track and measure and collect information um, on these equity indicators so that we can share with the public what we're doing here. Let's see. That's okay, guys, because I got some examples.
I was just pulling up some examples.
Okay, take your time.
Yeah.
I have one. I don't know necessarily where it falls, but do you think tracking engagement across all of the communication platforms could be trackable, especially if you're, not all people are on social media. Not all people have an email address. So even when you're handing out like physical flyers or posting things on bulletin boards, finding some way to track um, actual engagement with those, I think would be really interesting. At least to
Yeah.
know that you're like reaching people.
Okay, so not just tracking through social media, but also making sure we keep track of how many people we're passing out surveys to or how many people are actually seeing our posters and things. Yeah.
Or
Yeah.
how many brochures are being taken out of a stack or whatever.
Okay.
Yeah,
Absolutely.
I agree with Kylie on that one. I was in because in my mind I'm thinking, how do you create a pulse survey for that magnitude of individuals? And I would also agree to count the number of brochures actually being given out, and then trying to follow up in some kind of way just to test the connection of the knowledge of the material with the individuals, and maybe a survey, pulse survey in person or otherwise could be done in a month or so, or in a couple weeks, with that segment of the community, just to see where if that knowledge from the brochures was transferred at all.
Absolutely. So tracking, so surveys, checking to see how many brochures were taken, seeing how many
Yeah.
surveys have been passed out.
So, for example, if we went to, let's say, an apartment building complex to hand out these brochures, in a certain amount of designated time later, we could go back to that same community and literally have individuals just seek to ask questions of residents to see if, how much they actually took from it, if that process even was workable or not.
Okay, absolutely. Thank you, Charles and Kylie.
I thought of another one. Maybe, I don't know, again, if this information is accessible already, but finding the distribution of language across each Tarrant County zip code might be interesting.
Mm.
Because, literacy in some areas, of course, is higher than in others, but is it due to language barriers? Is it due to materials not being distributed in the proper languages for that zip code? Like, it's not like a blanket distribution of materials, So finding out which languages are spoken in which zip codes.
Okay, yeah, we definitely have some zip code data, but we can look a little further and definitely get a little more for sure. Julia, did you have something that you were going to say?
Yes, I did. It's regarding the early childhood learning as it applies to equity indicators. So we all know that early enrollment for like pre-K can translate into higher success in education, and I do know those are already kind of tracked enrollment numbers. But we could also take that opportunity to make the health information accessible and also geared toward uh, health literacy, in that the verbiage is plain language, geared toward education levels with parents, and language barriers. So we could take that opportunity to use those practices to disseminate information on, childhood health issues like vaccination, and you can disseminate it that way while also practicing or having good communication practices.
Okay, so let me just confirm, Julia. So you're saying, so you're acknowledging enrollment in preschool, early preschool, but basically utilizing that same service to disseminate health information to parents about vaccines and things. Is that what you're saying?
Yeah, like childhood health issues like vaccines, and that could
Okay.
also include, like reading campaigns if you start early childhood. Yeah, that kind of information. That could, um, I'm sorry, that could pertain to the accessibility and dissemination, as well as using a parent or guardian's uh, education to address health literacy to make it more readable to them.
Absolutely. Okay, now that makes perfect sense. Thank you, Julia. Thank you, Julia. Anybody else have anything they'd like to input? That's okay. So again, like I said, I'll send over these example plans because some of them will also have some example indicators. I know equity indicators might be a new term for some people. So that way, once you all take a look at these plans, maybe you all might get some other ideas of different things we might be able to implement as we try to measure our own indicators. Um, but just for example, as we talk about literacy, some ways that we can measure literacy is, of course, through early early childhood enrollment. So how often are students children enrolling in pre-K? Of course, literacy levels, educational attainment outside of high school. So these are just some ways that we could measure literacy. So I would love for everyone to continue to think on that a little bit. And then the second question, I know Julia did address this a little bit, but I did want to open that back up, given that we do have a recent alliance with the Early Learning Alliance, and they want to provide us with as much information and resources as they can. So I definitely want to take any questions that you all have for them. That way I can share with them and we can, make that exchange of information. So if any of you have any questions or any concerns specifically regarding early childhood learning, please let me know, or please, feel free to share that with us. I see Kali put in the chat density of early learning centers by zip code and density of in low income areas. I'll definitely be sure to share that with them when I have my meeting with them soon. Any other questions or anything for early childhood learning? That's all right, you guys. That's all right. I know it's early. I know it's early. Okay. Well, looking ahead, in preparation for our next meeting, I'd like to provide everyone with a little homework assignment. It sounds daunting, but it's no pressure because we have a whole month to think on it. So I'd like for us all to think about and write out some short term, long term, medium term, and long term goals and strategies for affecting equitable communication change in Tarrant County. I'll also be working on this assignment as well. So feel free to reach out to me or anyone else that's in this committee to exchange any ideas. And of course, I definitely will look forward to discussing this with everyone in our next communication committee meeting next month. And so that's all for the communication meeting today. Just as a brief reminder, we have our next health committee meeting upcoming this Wednesday on May 18th from 2 p.m. to 3 p.m. Our very first transportation committee meeting next Monday on May 23rd from 1:30 p.m. to 2:30 p.m. And our next Tarrant County Unity Council meeting will be on Thursday, May 26th from 9 a.m. to 11 a.m. And remember, we welcome everybody to attend any and all of these meetings. So if you have anyone or know any colleagues or community associates that might contribute or benefit to the work that we're doing here, please feel free to provide them my contact information or send them my way, and I'll be happy to get them connected with the proper committee leaders. Okay. Thank you all for your time this morning. And I would like for everyone to enjoy the rest of their day and have a great week.
Bye, everyone.
Bye.
Thanks, Tanisha.
Thank you.